So what a great model for them to transition from school and academics into the real world of dentistry.
Hello, ladies and gentlemen. Welcome back to Commercial Real Estate Secrets. I'm your host, Austin Hare. And our guest is Dr. Bill Piskorowski. He's the Associate Dean for Community-Based Clinical Education at UCLA, and he has been a licensed dentist since 1979, which puts him right at about 43 years of experience in the industry. So, Dr. Piskorowski, thank you for coming on the show.
Thank you, Austin. It's a pleasure to be here.
Yeah. So, all right, let's start at the beginning. What was it like? What made you decide to go into the field of dentistry?
It was all by chance and mentorship and haphazard relationships, if you will. But in my late teens, I went to my dentist for the very first time and found out that I had 17 cavities as a teenager at 17 years of age.
Wow.
And I quickly learned about dentistry from this individual. But what I learned more from him, and his name is Dr. Stan Tulak, and Stan allowed and fixed my mouth for $1 of filling. And he allowed me to work that off in his lab. So I became very aware, but he was a true professional. He was very involved with the Rotary, and I learned a lot from him.
I mean, even accounting for inflation, that's way below market rate. I mean, was he just as a nice guy?
Yeah, he saw something in me that I didn't see in myself. And then when I finished everything, he says, well, when you become a health professional, I want you to extend the same benefit to someone else. And I said, well, I really wasn't sharing with you that I was becoming a health professional. He goes, well, you will be. So he was a dentist that provided care to people of my background, meaning I grew up in a Polish community, basically. English was actually my second language. I started out speaking Polish. My parents were immigrants. They were from forced labor camp in Germany, and they emigrated to the United States.
Wow.
And so basically there were healthcare professionals that were helping people of similar backgrounds because access to care was very difficult, especially for people that were not comfortable with English as their primary language. So that kind of set the stage, and Dr. Tulak was Polish, but he, born in America, but he absolutely helped people of all backgrounds. He was heavily involved with the Rotary International, so he was a very giving spirit.
Wow, that's cool. It's cool to come across guys like that. Essentially, I don't know if you call it paying it forward or paying it backwards because you're obviously blessed, but either way, they're paying it out, and that's cool. So that sounds like it's really what motivated you to get into healthcare in general. So then, at that stage, how hard was it you had to go to college, obviously, and then you had to get accepted into dental school. I mean, what was that selection process like?
Like everything else, every journey you take in life is an exploratory. And I now know now a lot more than what I should have known back then when I was applying. And when I look at what it takes to apply to dental school today versus what it took back then, it is amazing what the caliber of students that were, getting to come into dental school at this point. They're so well-rounded and they're very sophisticated IT-wise. But at the same token, we have to learn and instill the main reason for why we're becoming professionals. And for me personally, it was about service to community. And I knew that Dr. Stan Tulak had a great life. He gave back to his community. He was an avid fisherman like myself. And I actually leased the room from him right after dental school and started my own practice within his practice. And then kind of outgrew that and left after about 5 years to another location up the road. And the rest is history. But I will share with you those first 4 years, very trying for me because I really didn't understand the business of dentistry. And I was an okay clinician, but I really needed help in the practice management field. And then I looked at my wife and I said, let's take a leap of faith. I need to enroll in a practice management course because I'm clueless as far as what this whole operational dentistry mantra is.
So it was like school prepared you, clinically, but not for the operation side, like the business operations.
Yeah, it was definitely baptism by fire for me. And, I had Dr. Tulak to learn from, but again, we had different styles. And we had a lot to learn. He was more on a very secured financial platform when I was just starting, and quite frankly, a lot was going on in my life at that time. Recent grad, got married, started a practice, bought a house. Man, you're talking about just everything in order that we had to figure out the hard way.
Yeah, yeah. A lot of life-changing variables in that situation. So, what happened? Like, how you said you enrolled in a program to learn more about business operations. How did that go? What did you learn from that?
I learned the business of dentistry from that, and quite frankly, it taught me how to look at data, how to analyze data sets. I take all emotion out of my decisions with data. That's how I work today. We look at systems. We empower. You could basically do anything that could be done one of can be done in multiples of 10 utilizing the same systems. And that just taught me how to empower other people, gave me better training and leadership skills, gave me the hindsight of not being a micromanager, but empowering other people to work in our efforts as well. So I just want to let you know is that it taught me a lot of life lessons and let me prioritize things in life. I have a very good, philosophical, religious background, but I needed help in the business background and the leadership background. And I found out that if your pie of life is sliced evenly, according to things that are important to you, it'll work and transcend across all stages with all your employees.
That's interesting. And when you say pie of life, I think about like, there's this chart that people use, and you can divide it into 4 sections or 8 or 10 or whatever, but it's like one component is your financial, and like your 1/4 of that is your financial and your business and like your career side. Another 1/4 of that is your relationships. That would be like your wife to your friendships, to even maybe even your colleagues. And then the other 1/4 would be the spiritual component, and then another 1/4 of that would be the fitness or the health component, like, because all 4 are kind of like connected, but like, you like growing your financial prowess won't affect your health, right? You have to physically do things for your health to affect it. It's not like you can overcompensate for your relationships by being more fit. Like they're all
absolutely
separate. Is that what you mean when you're talking about that?
Absolutely. And those slices of your pie of life change in dimension too. They're not equal slices, right? And as I shared with you, that when I first started my own practice, leased some space, had another practice being built, lived in an apartment, bought a house. Then I was moving from one house to another house and didn't sell my other house. And then coupled with that, my wife tells me we're pregnant, okay, with our first child. And then the monkey wrench came in, and I found out that my father was just diagnosed with chronic lymphocytic leukemia at the same time. So, you have to judge and balance a lot of things. And I have to tell you, when family comes first in that equation, those slices are not of equal proportion, right? And this is what I tell my students. Your patients don't care if your dog died, that your child is sick. You've got to show up and perform and be professional. That's what it means to be a professional. And with all those challenges, you know what? There's the old saying that says, what doesn't kill you makes you stronger. But I came across another quote recently on LinkedIn. It says, well, what doesn't kill you tries to mutate and tries again. So, you have to really be solid in your background. And I have to tell you that having a great family support with my wife and helping us go to the next step was paramount in this whole, discussion of going forward, because the practice management curriculum that I took was not inexpensive, but it was very valuable. Okay. But that's the basis of how I look at things when I manage even today's program, when I partner with affiliate organizations that I rotate my students to right now in their 4th year. So I look and analyze those clinics before I send students out the front door. And it's through their eyes that we try to make changes in those clinics when and if necessary, or we congratulate them for doing a very nice job. So to give you an idea, when I first started this program at University of Michigan, I had 3 clinics, all in the public health sector with 6 doctors. When I left, we had 39 locations with 117 doctors, representing 6 different healthcare delivery models.
Wow.
You know what? And we only could expand because we were growing with good partners, true champions that were giving back to their communities. And I have to tell you that we never looked back, and the program is thriving today at U of M, with 2 of my best friends still managing that program after I left to go to UCLA to develop a similar program.
So how did you go from private practice management, to the education system? Like those 39 locations that you just mentioned, would that fall under private practice, or were you starting to work in the educational field at that side or at that point in time?
Well, as I used to be a clinical educator and a reviewer of products for the Dental Advisor in Ann Arbor, Michigan, its publication. And it was Dr. Bill Gregory, who was the editor of that asked me to become a teacher, a clinical teacher. And I said, I have no desire to be a teacher. He says, well, I like the way you write articles and everything. I say, yeah, but I take my day off, I go fly fishing. Okay. And he goes, well, you can't fly.
Is that a requirement to be a dentist? Do you have to either fish or golf?
I believe so. And it was because I was such a bad golfer that I became a fly fisherman. Golf was a frustrating game, and I've never had a bad day on the river. Okay. So I truly will tell you that, you have to take something to purge your mind off of things, right? And I found that going fly fishing or even playing golf or whatever, in that moment, we allowed our brains to rejuvenate, to totally relax. But Dr. Bill Gregory asked me to become a clinical teacher, and I tried it and I fell in love with it. And then 5 years later, the dean at the University of Michigan asked me to compete for the directorship's job, which I did. And I said, Director of Outreach, what does that mean? Because I had no clue. Okay, but I was at that point selling my practice and coming on board in education full time. And I have to tell you, it's because of that practice management experiences that I now look at clinics and through a business sense, which is not common in the academic world.
Yeah, I would say it's a big problem.
Oh my God. I used to think the military was the mother of all bureaucracies. Academia puts that to shame.
Yeah.
But for all the right reasons, we have to make sure that we're sending our students to the right project. Okay.
Yeah. Yeah. Okay. So when did you start working with UCLA? What time frame was this?
I was recruited in 2017 after 11 years of managing the program at University of Michigan. Okay. And it was the department chair at U of M, Dr. Paul Krebsbach, that became the dean of UCLA from Michigan, that recruited me to come and help him design the program at UCLA. Because he knew of my work.
All right, so let's go more into depth about the program that you developed. So like pretty much you developed this program at Michigan, and then you took it over to UCLA, right? So what is the program that you're talking about? Let's go into some specifics here. Okay,
so number one, it's the mission statement is enhancing our students' education while increasing access to care accountably and sustainably. Okay. So what we're trying to do is open our students' eyes to all practice opportunities before they graduate. And this experience allows them to do self-assessment on a platform of 13 clinical markers to see what they need to do after graduation to become more proficient in their profession. And I have to tell you, it's a great resource because it becomes a working interview in a lot of cases for our students. Many of our students get hired while they're on rotation. But number one is I try to look at opportunities that give back to patients that struggle with access to care, be it from a demographic standpoint, a financial standpoint, whatever their social determinants of health that preclude them from getting care. We try to target those locations and try to make clinics that are providing that type of care more whole. And so I started investigating different things. So public health clinics, then we had private practices that gave back to the communities. Then we had private practices that started 501(c) philanthropic practices to give back to the communities. Those are the true champions, if you will. And we found out that champions really do engage in community service, and what they love is accountability. So ergo, we measured everything from everything that our students did, and they truly enjoyed that. And many of our partners actually won awards from the American Dental Association for participation in these community service programs. So we're trying to let our students learn from the very best and brightest in the business and to create different opportunities. So in Michigan, I had private practices, I had tribal clinics, I had public health clinics that were state, local, or federally funded. We had private practices that created their own 501(c)(3). We developed our own philanthropic organizations with Victors for Veterans, Victor's Open Arms, Wolverine Patriot Program, and now Bruin Smiles is another one we're now working on in the California market. So we're creating our practices and we're allowing our students to develop these unique platforms and to understand what it truly means to become a healthcare professional. Because I contend that if someone gave back 3% of their time, money, or energy, we would not have a crisis in delivering healthcare.
Yeah. Yeah, that's interesting. So, and it's such a small number, right? 3% is
It
so
is
manageable. So,
but I have to tell you, I'll paraphrase Ralph Waldo Emerson. It says, you cannot possibly help another person without helping yourself first.
Mhm.
And that resonates. And I have to tell you, it just tells us who we are as beings.
Yeah. Yeah. No, I think it's great. So the 39 practices in Michigan, there wasn't one DSO, right? Are these 39 different locations?
We were just discussing getting involved with DSOs at that point. And I will share with you that not all dental schools embraced participation with dental support organizations or service organizations, okay? There's still this mantra that some are evil, but I will tell you that there's just as many, how do you say, great practices in the private practice sector as there are in DSO sectors, okay?
Yeah.
And, you know, quite frankly, I've worked with many. And I have to tell you that the model I've developed at Michigan now is in part or in totality at 4 different universities with 16 total schools now looking at the model. And there are 13 DSOs now that are looking to become part of the process. And we have relationships with 6. And I did not have relationships with DSOs at the University of Michigan.
Okay. Yeah, there's been a big shift, obviously, you know, with a lot of mergers and acquisitions, like the whole industry is getting conglomerated. And, you know, obviously there are pros and cons. I think that it's got a bad name, like DSOs and, you know, big corporations have a bad name because of the way that it was done like back in the 90s or maybe early 2000s, but it's very different now. And, you know, at the end of the day, you're going to have to form some sort of or join some form of coalition if you want to stay relevant, because what happens is you get group purchasing power, right? And you get economies of scale, and that results in you being able to deliver healthcare at a more affordable price, oftentimes to the patient. And so I think it's just like a direction that the industry is going that everybody's going to have to get on board in one way or another.
You know, Austin, I have to tell you what's really interesting about this contract model that I'm developing and working with other people on is that we're literally increasing and doubling our students' experience without increasing their tuition. Okay. So would you rather go to a dental school that provided 10,000 procedures for the graduating class or 5,000? You know, under mentorship, you can't help to become better if the volume increases, right? And gives you what I consider real market experiences. And it's the confidence that we want to say. And a lot of schools are kind of apprehensive about expanding their community base because they think they're going to lose revenue in their clinics at school. And in fact, we've proven the opposite, that our students become more prepared, they come back more productive. And in fact, our clinic revenues have actually stayed the same, with even going out of the clinic more, or has increased at both schools that we've developed these programs at. You know, so I'm going to share with you is that we're opening the eyes, and quite frankly, I am not so enamored with the organization name that I deal with as I am with the doctors that run the clinics that we send our students to. So we might have DSO X. What they've done is select wisely, because the world will know tomorrow about the quality of the organization through our students' social platforms, right? And I have to tell you, a lot of these DSOs are now picking the cream of the crop, or the doctors that have won some sort of mentorship award within their organization, and that's their representative sample. That's the wisest way to do it. And over time, I will share with you that this is something that's going to really help them out with recruitment and retention. And the statistic that I have from the public health sector, in the year 2000, only 1.7% of all graduates were going into public health clinics after graduation.
Wow.
When I left Michigan, 22% of our graduating class went into public health, 10 times the national average. And why? Because we chose clinics and developed clinics that had great mentorship and provided growth for those people after graduation. So they found out, try it, you'll like it, in non-traditional model sense, right? So now we expect to see the same thing happen in the DSO market. And that is, you know what, if you like an organization, I'm dealing with 6. I'm going to say this, you should have a different experience and different models to be selective, because many students try certain DSOs and they don't like it and they quit after 6 months. That's very disruptive to your growth. So I just want them to be aware and teach the model in the academic environment before they go out into the real world and see which one of those organizations is really working at the level that you want to be part of.
Why do you think the number is so low? Like you said, 1.7% nationally going to public health. Is that because there's a lot less money to be made?
That's not necessarily true as far as the money, because they're, now with loan repayments on the federal government side going into what I call dental desert areas, the money could be comparable, but most people do not select their practice opportunity on money. It's more or less on what's going to develop them professionally. Okay. And I always say that nowadays, when I graduated from dental school, there was this perception that you were less than adequate dental provider if you went into a public health clinic. After reviewing those 117 doctors that I worked with, I can't even lick the boots off half of them, that worked in the public health sector. So that is total nonsense now. They're very, very, very professional, and they're very accomplished dental surgeons, if you will. So I just want to share with you, it's more about just saying, where is this growth model going to happen, to give the confidence, back to our students to go out and perform their daily duties. Because in the last 2 years, I have to tell you, the clinical services that our students provide has dropped immensely because of COVID. So I'm looking at ways that we could now boost up their productivity and gain their confidence before they graduate. And the DSO market really stepped up in that venue. So I'm just saying to you, I'm just giving their opportunity to experience all types of opportunities after graduation.
Okay. All right. Let me try and explain or summarize your program in a nutshell, and then correct me if I'm wrong, and we can go into further detail. But what you do is you create a program for students through UCLA, as an example, to essentially go out and get in touch with actual DSOs and begin working clinically during their residency, or during what part of dental school?
So it's in their 4th year, and right now at the University of at UCLA, we do 2 3-week rotations, soon to be 2 4-week rotations is the goal. And when I was at Michigan, we did 3 4-week rotations. So the students go anywhere from 6 weeks now to hopefully 8 to 12 weeks in the future in their 4th year. And these are professionals that are going to be able to call me Bill in 5 to 6 months when they graduate. Okay. Once they get their license, we're colleagues. Okay. And their license is every bit as good as mine. And I'm just trying to give them an awareness of what they can do. So they provide in their senior year, at this present time, 6 weeks of outreach at different models, usually 2 different models. And then they come back and graduate. Okay. And what we have found out, that many are selecting to go right into practice as opposed to GPRs or residencies, because the program has given them confidence to go to the next level.
So can you explain how the school benefits, how the student benefits, and how the dental service organization or the practice that they're going to will benefit?
Oh, there are so many tangible and intangible things. So for instance, I charge a per diem rate for our students to go out on a daily basis, and it's basically the cost of a dental assistant. but that cost helps the dental school pay for the travel costs, the lodging costs, the rental cars, whether they're local or in another state. That per diem rate is set in stone, and we negotiate that based upon productivity over a 3-month period of time going forward. Now, with those monies, we create the platforms, we have accountability. I have an IT system where our students mark all our procedures. We know in real time what we've done. And at a minimum, this does not cost the site anything that accepts our students because of our students' productivity. We're averaging around 6 patients a day and 9 procedures per day. So if I just took raw numbers of $150 per procedure, and if I was charging you $200 a day, our average student was doing anywhere from $1,500 to $2,000 a day in productivity. So you're getting a working interview. You're protected with credentials as being an adjunct clinical educator for the UCLA School of Dentistry. That gives you a liability protection as if you were a teacher at school. You can also, in certain venues, if you prove that this is something you want to go forward with, you can actually do co-branding with UCLA in certain instances. And also you have the recruitment and retention. And what I found out in the DSO world, they're spending anywhere from $5,000 to $40,000 to recruit an individual, and they've never seen that individual work. All right.
I heard that's the number one cause for DSOs to fail or backslide is the doctor retention.
Absolutely. So I just want to share with you is that we become a farm system, and it's helping our students. So now many of our DSOs, they treat all stages and ages and take all payer mixes, okay, from Medicaid all the way to third-party payers. And depending on the model, we have proven that we are at least a 3 times, and in some instances up to a 9-time return on investment financially. And I'm not even talking about the HR component, because through our students' evaluations, I literally have become, with our team, a HR system for these clinics saying, well, you know what, your doctors are doing this, your assistants are doing this, and in return, you're telling me what my students are doing and what they need to improve upon based on all these platforms of assessments that we do. And we review this data every 3 weeks, okay? And when necessary, we have those difficult conversations with either the COO or the dentist that's providing oversight based upon, I always ask the organization, do you want to handle this or should I? Do you want to give the compliment or should I? You know, this is kind of a great thing because we're finding out that from our students, is this a good place to be? And I have dismissed clinics from our operation. I've dismissed doctors, but I also will tell you that's not the norm, because those clinics that are choosing to be part of this are really becoming what I call true champions. And one of the greatest growth sectors were dentists that were retiring that wanted to come back and be teachers.
Oh.
Okay. Because what we found out is that someone like, say, in my age bracket can't do 20 patients a day anymore, but we can easily supervise 2 to 6 students in restorative care or 2 in surgical care, have fun doing it, and give back to the communities. Because, you know, like I said, 40 some years of knowledge doesn't just grow on trees, right?
Yeah, you learned a thing or two. So essentially, you know, what if you're partnering with a school like UCLA, like that has your program, you for 20% of the cost, you can get students that are 70% as productive as doctors.
Absolutely, 0.7. And that's in general practice. So restorative care, pain management, root canals, that's where we help practices, especially if they're very busy in these rural areas, where then the attending could do more advanced cases while our students are doing the baseline cases to gain that confidence, okay? Because you'll find out that just like in residency programs in medicine, as we do have in dentistry, that the growth cycle in providing care really occurs very quickly. I used to always tell my students, I did all my clinical requirements in dental school in the first 2 weeks of private practice. Okay, I mean, think about that. And that is absolutely a true statement. Because the number of procedures that we were doing in a given day versus 2 in school, And then now in my outreach programs, my students are doing, say, 9. So what a great model for them to transition from school and academics into the real world of dentistry.
That's cool. And then let's talk a little bit more about defining champion. You said you've had to let some practices go that you partner with, and you're looking for the true champions. I mean, like, how do you define a champion and somebody that's a good partner for you?
You know, like anything else, you can walk into a dental clinic and know within 10 minutes if this is going to be a winner for you or not. Okay. And I'll share with you that when I first schedule an appointment, I usually schedule the first appointment of the day with the site. And I usually show up a half an hour early, and I watch the demeanor of the employees as they walk into the building. Are they excited to be there? Are they just kind of shuffling their feet? And then I present myself at the front desk, okay? And I see how the operation works. You know, are they organized? Are they dutifully managed? But before all that, and how do we select it? I do presentations at component dental societies and asking, do people give back in those communities? And you'll find out that there's a handful of doctors in every component dental society of each state that routinely give back to the community. And those are the ones that I pick on. So those that have a history of benevolence and philanthropy are the ones that truly want to become part of this. And when we show them the structure of accountability and sustainability, I'll share with you that it's not a very difficult sell to have them come on board, and they expand their efforts, and they do it for various reasons. And I have to tell you, I don't care what the intention of the doctor is, because a good deed's a good deed regardless of the motive. So if you open up your clinic and you allow my students to come and work on underserved populations, or if you want to access and give a break to some of your patients through a 501(c)(3) fee schedule that uses say the fees of the dental school at your private practice. There's so many different ways of creating this giving back attitude to communities. And it's just a really good feel good effort. And I truly enjoy helping champions magnify their opportunities.
So right now you're at UCLA. Are you planning on growing this like to more places of the country, or is it going to stay kind of central, like regionalized?
Our plan has always been to disseminate a model that works. Okay. If I had to put it in a nutshell, at UCLA, we're trying to create what we call an academic dental support organization, meaning those organizations like DSOs or public health clinics or correctional facilities or mobile platforms. If you want to engage with the dental school, we can share with you how to bring that apart and how to affiliate with another dental school, okay, through this platform, and centralize these processes so we don't have to reinvent the wheel. So if, say, a DSO takes students from 6 different organizations or dental schools, why do we have to manage or evaluate student performance on 6 different platforms? We're trying and centralize this information, because the majority of money that I spend with my team is development of the IT system for accountability. I went from paper, which took me 6 months to make decisions, back in 2006, to docking stations and tablets, to a web-based platform, and now I'm on an IT cloud-based platform. So we can make real-time decisions. I could literally open up our laptop and see what student X is doing at this clinic right now.
Wow.
Okay,
wow, that's cool.
So it's all about accountability, and we manage our data to the point where we understand the profile of a clinic, we understand the experience of the student, and we understand the caliber and the strengths of the doctors and the clinics that we're associated with.
Yeah, I think it's good. I think it's really important, especially, when, like you said, academia, there's a lot of bureaucracy. We need programs like this that really teach business acumen and accountability.
So if you're teaching the practice model before the student goes out to that delivery model, and then you give them firsthand experience, it doesn't cost the students or the school anything. And in fact, there's a return on investment for the affiliated clinic. I know it doesn't take a rocket scientist to figure out that you should at least try it. and go
Right.
through the
Yeah.
pilot program, right?
Yeah.
Because it's a win-win for everyone concerned, because when you're doubling student experiences and it costs them nothing, okay, more, I have to tell you, this is all about creating a better healthcare professional in the long run. And that's what we want to do, is disseminate this model for those that need assistance in this arena. And quite frankly, I'm very proud to say that we are creating a better healthcare provider through this platform.
That's cool. Well, I want to be respectful of your time here, but is there anything that we missed that we didn't talk about that you'd like to add?
You know, Austin, like anything else, you're kind of like in the same business that I am. You're helping other people succeed, okay, by transference of information, right? And all I can share with you is that you allowing me to share this platform today at least opens eyes of other people. And please share my contact information with whomever that might suggest they want to see what this is all about. And even if we don't have the bandwidth to go in your state, I can at least share with you how to get the program developed in your area, or some, how do you say it, shortening the learning curve, not only my students, but of organizations that we are working with to make this a better option.
Okay. And I'll write down your email address in the show notes, but do you want to spell it out for anybody who's listening right now?
Sure. It's my first initial, B as in Bill, Piskorowski, Piskorowski, at dentistry.ucla.edu.
Okay. Awesome. Well, hey, listen, thanks so much. It's been really insightful. I think what you're doing is a really important niche and an important need for academia and within dentistry. And so I'm looking forward to seeing what you guys have in the future.
Well, thank you so much. And I'm glad you had a nice Merry Christmas. I saw those nice photographs you posted. And you know what? Enjoy the new year, okay? And thank you again,
you too.
Austin.
You too.
All right.